Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And I've been asked by several folks, what do I pay attention to? What am I trying to follow in terms of this pandemic? And to me, there's really 8 things I think are important to follow. Basic ongoing questions. The first is the virus mutating? Is it getting more or less virulent? There's at least some data coming out of China to suggest it may be mutating, as most viruses do. Whether this is a good or bad thing, we may not know for a while, but that's something I'm certainly following. Another important issue is whether or not infection or in the future a vaccine will confer immunity. There's some reason to believe that infection does confer immunity, and there was some data out of China and South Korea to suggest that perhaps it does not. Or it could be a little bit like the flu, where the virus changes just enough each year that immunity has to be supported with a vaccine. The third issue that I think is pretty important is what are the chances of exposure from someone who's asymptomatic? And we had some data this week from the CDC that I think is important. The CDC reports this week that probably a third of the people who are infected with SARS-CoV-2, the virus that causes COVID-19, are asymptomatic, and that perhaps 40% of people are infected by someone who isn't showing symptoms. This is really important. The first one's important in really 2 different ways. On the one hand, it's a good thing if people are getting infected and not getting sick. We're happy for that. But at the other side of the coin, what that means is there are folks walking around who can be spreading the virus who show no symptoms at all. And almost half, 40% of people, are being infected by someone who hasn't yet shown symptoms. What this means is it is really, really important to continue to practice good social distancing and hygiene. Even if someone doesn't look sick, we may well be exposed to them. So we need to continue wearing masks when we're out in public, continue to practice good social distancing and hygiene. The fourth thing I'm following is this new data about the virus as it impacts children and young adults. We know that the death rate in children is much less than it is in adults, but there appear to be some new syndromes, some new clinical presentations in children and young adults that we haven't seen before. And we need to understand that because we've typically thought that kids are relatively safe, and they may or may not be. The fifth thing, and this really worries me, is there was a report this week that 45% of tweets on Twitter are being propagated by bots. In other words, false information being purposely spread, probably for the purpose of sowing social discourse. We saw this, of course, with the election in 2016. There's pretty good data that we're seeing it with the anti-vaccine movement, that there are folks who, for whatever reason, are trying to divide us as a country. There's nothing intrinsically political about COVID-19, and we have to make sure that when we're being divided, that we're being divided for reasons that make sense and not for false information that's being propagated on the web. Obviously, it's very, very important that we can assure that students receive a safe and meaningful education. We're talking about how we can bring students back to ETSU, but also K through 12 and other universities. How do we do this in a way that we can give students the education that they need and still protect them to the extent possible? Another question that I've been worried with, especially the second part of this, is will we be able to protect ourselves, especially our elderly, as we reopen? We know the death rate in elderly is probably about 3 to 4 times the overall death rate. We need to make sure that we protect them as we reopen. We have to reopen at some point, but we also have to make sure that we protect the elderly. And finally, the question, of course, that everyone's been asking is, will there be a second wave or a third wave to the pandemic? I think most people think that there probably will be, but we haven't seen that yet. So those are the things I'm paying attention to. If there are issues that you're paying attention to, let me know. I'd be happy to try to find an answer for you. Thank you very much.